There we go. Okay, great. And we are off. So welcome to our summer, or kind of kicking off the summer perinatal collaborative meeting. Thank you everyone for joining us. And thank you so much to our speakers. We're really thrilled to have you and looking forward to today's content. If anyone does need to leave early for any reason, just remember we'll have both our slides and our recording posted on our website. So that should be indefinitely available to you to look back at a future date. And I'll send out a reminder to everyone to let them know that that is posted on our website. All right, so on our agenda today, we're going to have an awesome presentation by Lyndsey Williams with Kenneally Care Therapy, our rapid relief strategies to prevent burnout. I know a lot of us providers, it's always something that we're facing and the nature of the work that we're doing. So thank you so much, Lyndsey, for joining us to discuss that. And then we'll be moving on to a presentation by the Hope Project, Healthy Outcomes for Positive Experiences. And I'd like to welcome Claire Kenneally from Washington DOH. We've got Rumyana Kudeva and Jennifer Hansen from Spokane Regional Health District, and Malvina Goodwin from the Benton Franklin Health District are all here to help us out with that presentation. So thank you so much and welcome everyone for being here today. And just a few logistical reminders. Please do keep your camera and microphone off unless you're speaking. We have hopefully worked in time to both into all of our presentations for questions at the end. And I will be doing my best to monitor the chat for any questions. And also please do use your raise hand function for that as well. And again, this meeting will be recorded and posted. And we'll pause for our land acknowledgement. If there's any issues hearing the audio on this, please go ahead and come off mute and let me know.
It is the land right here that the Puyallup people have lived on since the beginning. This
right here is where we are in the world, our homelands.
We work on our ancestral lands. We raise our children who go to school on the land of the Puyallup people.
We acknowledge that the Medicine Creek Treaty was signed for the whites to take our land for their benefit.
Is it playing, Kendra? I'm not hearing anything.
Oh, you're not?
I'm not hearing anything.
Is that the case for everyone?
It's working for others.
Land was assigned to our people. The Caucasians said, "This is your land," and they took that land from us too.
Our land was stolen from us. Treaties were broken.
But we are still here today.
Our people forage for food and materials, we pick berries, we canoe, we practice our traditional ways, and we speak Twelshutsi.
Just as our ancestors did.
We are finished.
Thank you everyone for joining me for that land acknowledgement. Lyndsey, if you are feeling ready to jump right in, I'd like to welcome you again for joining us. We really appreciate you sharing your expertise with our group today. I'll be running the slide deck for you, so please just let me know whenever you're ready to advance slides. And folks, will do our best to have some time for questions at the end of the presentation.
Thank you. Good afternoon, everyone. I'm Lyndsey Williams, and I'm going to be presenting today on rapid relief and quick strategies to fight burnout. We can go to the next slide. So a little bit about me. I'm a licensed clinical social worker. I also have my PMH-C, so I'm perinatal mental health certified. I've had over 8 years of experience in women's mental health. And most of my experience has been in primary care, so working in integrated behavioral health care in OBGYN clinics and on like maternal child health floors in main hospital. Currently, I am the clinical director and owner of my own private practice, Kenneally Care Therapy, where we specialize in reproductive and mental health, community workshops, provider trainings and consultations in Washington, Idaho, Maryland, and Washington, D.C. So what's burnout? Burnout is, we all know what it feels like. I don't think I have to, read these lines. But burnout is a state of physical, mental, and emotional exhaustion that can be caused by chronic stress, and is often associated with work-related stressors. But we also can feel burnout from like a combination of things. So that's our work life and our personal life. The healthcare environment with its packed work days, demanding pace, time pressures, constraints and emotional intensity can put support staff, physicians, and other clinicians at high risk of burnout. Some of the things that lead to burnout include, patient volume, time visits, needing more time to see patients than we have, emergent situations and crises, structural racism, low staffing issues. In the perinatal world, there is a big I think in most healthcare, but in our world, there is a lot of pressure for perfectionism. And that can also lead to burnout. We have societal barriers. We have complex, patient complexity, health issues, high health needs, and definitely labor and delivery demands. We can go to the next slide. So warning signs of burnout. How do you know if you're feeling burned out? Well, usually it's characterized by exhaustion, making kind of careless mistakes, things you wouldn't normally do, irritation and conflict with coworkers, decreased peer and patient engagement, missing more days at work, calling out more, low motivation, not feeling it or the spark. And we can normally tell on our teams when it comes to staff turnover. In this graphic on the side, it kind of, has more language about some of the warning signs of burnout and what's happening. We can go to the next slide. So what are the antidotes? Today, I will be talking more on how to fight burnout through mindset support, self-care breaks, and through team building. We can go to the next slide. Oh. So what is mindset building? Mindset building is the process of training your mind and body to be aware of how you feel, think, and perceive things. Mindsets are a collection of beliefs and attitudes that shape how we understand ourselves and the world around us. And they influence how we behave, think, and act and feel in any situation. A quote that I like is from Jen Brewer, in her book, Helping Effortlessly. And she says, as helpers, we often feel the need to see our impact in tangible, measurable ways. We allow negative language into our head about the broken system, and we look through a lens of, it doesn't matter, I can't make a difference. These ideas are surely contributing to our burnout. So ways that we can build our mindset includes set values and goals outside of clinic metrics, or a set of work goals. Prioritize your needs, acknowledging feelings, practicing morning meditations or affirmations as a team or individually, picking out your favorite mantras as a team or individually and putting it up in visible areas or workspaces, keeping track of our accomplishments, and focusing on acceptance. Next slide. Every day doesn't go the way that we want it to go, but centering our values and goals in our professional, family, and personal lives helps us to feel accomplished no matter what happens. So one way to do this is to make a list of 3 values or priorities that you have in each of these spheres: professional, personal, and family life. What are 3 things that make it a good day for you in these areas? So for instance, back when I used to work in the clinic full time, one of my values and priorities was I wanted to make sure I gave extra resources to my clients no matter what happened. I wanted to at least see 3 smiles that day from my fellow staff as well as from patients. On a personal level, it was always a priority for me that I picked up a cool snack for my son when I picked him up from school in the evening. And I felt like I didn't let my workday take over too much, that I couldn't get him a snack. And so those have been some of my values and priorities, or what would make it a good day for me. Keeping track of accomplishments and wins is very important, especially like in the work that we do, because it can always feel like there's more work to be done. But one of my favorite self-care practices is on Fridays, I usually like to write all the things that I've done that week, whether they were just completed tasks or I guess all out accomplishments. And I typically have like over 10 things on that list. So when we kind of take that time, we notice that we do more than what we give ourselves credit for. Another thing is not to be like rigid with our values or our priorities. So sometimes we can have it, in our head about what's most important, but life is kind of rearranging those priorities. So allow your values and priorities to oscillate with each other. You're only one person. And when we're rigid, it can definitely contribute to burnout. We can go to the next slide. So helpful statements that you can say to yourself can be these examples here. So something like, this patient is difficult, but I value providing extra resources. My goal is to make 5 patients smile today. I made X amount of referrals to community resources this week. I will be extra mindful to hold on to positive statements of gratitude from patients and colleagues. Positive energy I will put out will be returned to me. My job is what I choose to do, but not who I am. Challenges present opportunities for growth and will enhance my work with patients in the future. These are all like helpful. These are either statements or mantras that can help in these works. We can go to the next slide. So another part of fighting burnout is taking breaks. If everybody can do this exercise that's on this graphic, is one of my favorite mindfulness activities. So I'm going to kind of say it, but you can do it on your end. You put your hand up and you take your finger and you really focus your eyes and attention on it. And you put it on the outside of your thumb and you start to trace your hand. So you breathe in and then you breathe out. And you practice this with all of your fingers. Inhale, exhale, inhale, exhale, inhale, exhale. That's a little fast. That we like to do it for mindfulness. But if you slow that down, or if you're doing it on the other side of the screen right now while I'm talking, you might really feel some calmness inside, or just feel like you've kind of reset and refocused. If you have breaks during the day, make sure that you're designing and planning them. I don't know why those lines are together, but make sure that you're designing or planning them. A lot of times we get to break time, we're like, what are we gonna do? What are we gonna do? And we run out of time. So knowing what you're gonna do during that time to make it effective, bring headphones, take 5 minutes to do a mindfulness meditation, watch TV, or get in a movement break. Try audiobooks. I do think that they're really good when we're just trying to take a mental break because they can put us in a different setting. Always remember to use your PTO to fight burnout. A lot of times, I hear a lot of staff members tell me often, like, I want to take off work, but we're low staff, the team needs me, things like that. And we end up kind of adding to that burnout dynamic. Unfriend coworkers on social media. People, they don't like when I say this one sometimes, but some of, just our boundaries can also help with burnout. So if we are working with people, 5 days a week or interacting with them, and we know about their personal life during the weekend and we can see their posts, it can really create some overload that can, later lead to that conflict or just feeling like, burned out with the situation or kind of tired of it. Another good one is to also collect 5 to 10 positive images on your phone, like in a special album, or you can kind of post them up. And if you're having a difficult day or having issues with patients, kind of looking through those photos and regenerating those positive emotions can really be helpful. Next slide. So our clinical teams and leaders are essential in managing burnout. As a team, we should try to bring it in and choose mantras outside of organizational values that we hold dear. Opening the meeting with 2-minute silent breaks or freestyle time is something that I've worked with teams on, and they found it very helpful to just know that even as they were starting a meeting, they had a moment to kind of like catch their breath and gather themselves. During meetings, sharing helpful values. What's working for you might also work for your colleagues, and making sure that there's an open discussion about that to create growth. On a physical support level, popsicles and ice packs in break rooms are really exciting to have, and they can be very refreshing to have too. So, popsicles, they automatically give us a pick-me-up. But on a somatic level, they also kind of just help to calm us and relieve stress internally. I've seen like my old team, once we started this, we would hand out popsicles at the beginning of our staff meeting, and everybody kind of would just become, more engaged and more relaxed at that time. Also, if you're dealing with a difficult patient, ice packs, they can also help calm us. They help us to do like deep breathing and to reset. So those are helpful when we need them. I like to encourage movement during meetings too. That helps to reset the body. Offer fidgets in office, dim the lights when possible. Create team building by adopting a clinic, plant, or pet. And we can move to the next slide. So when should you use any of these techniques? When you're running late between patients, after delivering uncomfortable news, attend staff meeting after a string of difficult clients, when you're feeling overwhelmed by life's demands, when you mistakenly say the wrong thing to a patient and you're replaying it over in your mind over and over, after providing crisis support, or in other words, all the time. We should really try to engage these things in our day-to-day lives so that it creates a more prevention lifestyle for burnout. And we can go to the next slide. If you are interested in learning more about burnout and like where you might be, I know sometimes we feel like, we can automatically say, yes, I'm burned out, but we don't know, maybe where it lands. You can take the burnout assessment. And the CDC has a wonderful PDF report on burnout, especially for those in healthcare related service. So you can use those QR codes. And that is the close of my presentation. Thank you very much for your time.
Thank you so much, Lyndsey. That was awesome. I especially love the 5-finger breathing. I was definitely doing it while you were talking. That's great. I'm going to use that one for sure. Ingrid is in the chat saying that she definitely learned a few tricks today. I think we all did, and I'm excited to try the burnout assessment here. And oh, I'm excited too, or a little nervous too. I'm not sure. We have a few minutes available if there are any folks that had any questions or any additional comments for Lyndsey.
Can I jump even though I'm not from the collaborative?
Absolutely. Yeah.
I love all the ideas because they're so simple to do. Often when we think about burnout, we tend to go like to this big picture, which of course, in our organizational culture and everything else contributes to burnout, but that's really out of our control. So I just loved your talk and loved the ideas. And like just kept thinking about how much it feeds into this whole framework that we're going to talk about. So thank you so much for presenting on this.
Great, thank you. Karen, you have your hand up.
Yeah, I really like that talk. It was nice and short. I feel like we do have a lot of talk about burnout, but I think we can always use more tools. So I think that was just a perfect amount of great things. And I really like the popsicles because that's just kind of a nice, sweet treat. And also I just recently got a little bottle of bubbles at a kind of a opening of something and have found myself out on my deck blowing bubbles. And I think I may have to go buy more. And it's very kind of relaxing just to sit and watch the bubbles go around the yard and which way the wind is going to take them. And I just found that to be something, I don't know, it just seems really childlike and also just a nice way to just kind of breathe. That makes you breathe too. So that's helpful.
I love that. Thank both of you for your feedback. I was really trying to keep my experience in mind with this. Like, what did I need, when I was really working on frontline things? And I love that you brought up the bubbles. I had recently did a talk on like building your inner child in play, and blowing bubbles is one, that does come up, especially if we're feeling like tense or, a lot is on our mind, because you can't be unhappy when you're blowing bubbles. It automatically like puts a smile on your face.
Exactly. And my son I work from home. My older son works from home, and I was out on the front porch. And I said, look out your window. Like, can you see the bubbles? I don't know. I was like, maybe this will relax you too.
This reminds me of a moment that I experienced when I was out doing nurse home visiting. I was in the middle of a really stressful day between clients, and I just randomly saw bubbles pouring out of the side of a van that was driving in front of me on the road, and it completely changed everything about my mindset. So I think that, yeah, that like lightness and childlike play is really uplifting when it's in your space, whether you're the one doing it or not. Anyone else with any comments or questions? I do have one question, Lyndsey. I was wondering, you mentioned opening a meeting with either like 2 minutes of silent time or freestyle time. What exactly does it mean to have freestyle time? Is that like open conversation, or it's just time for folks to get to reset themselves? Like, what does that mean?
Yeah, totally. You got the idea. So freestyle time could be anything. It could be, I'll give you 2 minutes to scroll on your phone. 2 minutes to, if you want to like take a, wiggle break, go use the bathroom, go do whatever you need to do. But that can be freestyle time. It can be whatever the team likes. Maybe there's a team show you guys like to talk about, and you want to talk about it for 2 minutes, like what happened yesterday. So I think it can kind of help for people not to feel like they have to just jump in to whatever's on the agenda when they're just coming out of, whatever work situation they just had.
I love that. I think I'm going to give that a try at some of my next team meetings. That's great. We just had a comment from Ruba saying, I'd like to do mindfulness activities, breathing exercises, and grounding activities. Also, like awesome, simple things that you can take with you anywhere. I think what I really enjoyed, Lyndsey, was that with the simplicity of these things, because when I'm really thinking about burnout is when I tend to feel when I am the most burned out, and it's harder for me to remember to do preventative things. But when you're already feeling really burned out, having simple things you can pull out of your toolbox just feels the most feasible in those moments when you already feel so overly extended. I also had suggestions for going for walks. It's a good one, part of moving your body. Okay. I think I didn't miss any hands, so thank you again, Lyndsey. We really appreciate you coming and contributing to our group. I'm definitely going to put some of these to use, and I know plenty of other folks will as well. We do have Lyndsey's contact information up here, and then also all of these slides will be posted on our PCPC website. So thank you again, Lyndsey. I hope you have a really wonderful rest of your day.
Thank you. You too. Have a good day and week, everyone.
Oh, okay. So moving on to our next group of presenters, here to talk to us about the healthy outcomes from positive experiences HOPE framework. And I'm not sure who from your group was planning on popping on first.
That is me. Hello, everyone. Thank you for having us.
Hi, Claire. Thank you again. We welcome all of you so very much and are very much looking forward to learning about HOPE today. Again, I'll be managing your slides for you, but I will keep an eye on the chat. We should have time at the end of the presentation for more questions and discussions, and we have a full hour for this right now, so take it away.
Perfect. Thank you. I will start off with a personal disclaimer that I am doing some caregiving for some elderly relatives who might be popping in and out or sticking their head in to ask me questions. So if I have to pause, thank you all for your grace. But welcome. We are some folks from the Healthy Outcomes from Positive Experiences community of practice. We are a group that meets once a month and we represent a variety of local health jurisdictions. I myself work for the Department of Health. And we gather once a month. It is a bunch of folks who have taken a HOPE training. Perhaps it's from Tufts University. Perhaps it's something that I have taught, Rumyana has taught, Jen or Annie have taught. Perhaps it's groups of people who are just learning about the framework and want to dip their toes in the water. So it's a wide variety of people and experiences and backgrounds. But we meet once a month and we talk about this framework and we talk about ways to apply it in our work, and we share tips and tricks with each other about what is working. We would be excited to have any of you join us after this presentation if you're interested, and we will hop into the presentation. And if you have questions along the way, just let us know. We're happy to interrupt ourselves and answer them or go off on tangents. So I will have us go to the next slide, please. Our learning objectives for today. So our hope for all of you is that you will leave this presentation with some knowledge about the HOPE framework and that you will be able to draw some connections between HOPE and the work that you do providing trauma-informed care. We want to talk specifically about building perinatal resilience. That was a Freudian slip. We're going to talk a little bit about HOPE and how that can support the Washington Maternal Mortality Report recommendations, and we're going to talk about implementing HOPE. And next slide. We're going to start off by talking about the pair of ACEs. We're actually not going to spend a ton of time on ACEs during this presentation because what you're going to learn is that HOPE, Healthy Outcomes from Positive Experiences, actually focuses on what we call PCEs, positive childhood experience, instead of focusing overtly on ACEs, which are adverse childhood experiences. But a lot of us tend to have more familiarity or more training with ACEs. So we find it's always helpful to start by grounding with the pair of ACEs. For those of you that have never seen this before, this is an illustration where at the top you can see some microcosms of what happens when people are experiencing adverse childhood experiences. So you can see there are different types of abuse that someone might experience, some circumstances like homelessness, domestic violence, divorce. So things that are impacting members of our community around us or individuals in our lives or that we are working with. And then at the bottom, you see the environments that are often creating and leading to what you see at the top. So it's worth pointing out that about 40% of US adult populations report experiencing at least one or two adverse childhood experiences. So those, again, are going to be those things that you see at the top of the tree, the leaves. And while adverse childhood experiences can happen to anyone, we always want to draw attention to those who are most vulnerable and most marginalized and most suppressed, because children and adults that are living in adverse community environments tend to bear a greater burden of negative health outcomes. So that's folks that are impacted by the areas that they're living in, folks that are impacted by racial violence, things like that. And this pair of ACEs tree demonstrate the disparity in health outcomes and the connection to the lack of resources, and how that often results in the adverse childhood experiences that you see at the top. And when we don't have supportive systems and we don't have buffers, resources in the community to help folks overcome individual scenarios and situations that have been created because of what we see at the roots, we often see that presenting in the circumstances that we see at the top. Next slide, please.
And Claire, took that kind of bird eye view approach, the pair of ACEs, but we wanted also to mention the perinatal ACEs that you all have experience working with, with the populations you serve. We know that the perinatal period is really one of the most sensitive periods where trauma has huge impact, but so also is support and quality care. So why perinatal ACEs are so important is because of the knowledge that we have from the epigenetics and understanding from trauma-informed care about not only historic trauma, but also intergenerational trauma, and ACEs that get carried over from generation to generation. And we know in the work we do with perinatal populations and families that exactly in that sensitive period, we have this window of opportunity to break a cycle of intergenerational passing trauma through intergenerations. So and we don't have time to go into details about epigenetics, but just very briefly, what that is about really how the story is told of somebody, right? Like, we don't change the story necessarily, but how that story gets told is how we can think of epigenetics. And a lot of times what we see is like the person who maybe had ACEs, adverse experiences or trauma in their life, especially early in the childhood, maybe they figure out, they found coping, they found their people, they found like even mental health support to deal with that, the impacts of that trauma and adversity through life. But when a new period comes, and again, I'll mention that it's a sensitive period, pregnancy, childbirth, and postpartum. When such a sensitive time comes into life, maybe our coping becomes overwhelmed by the additional stress and then the additional unknowns. And that experience of really loss of control that we have during the perinatal period. So that's why it's even more important for us as providers, as professionals who work in the perinatal period, as just community members, is to really pay attention, to listen, and to make sure we tailor anything we do to the needs of that person and that family. And you can advance to the next slide. So good news is that we do have an antidote to the experiences, the impact of the adverse childhood experiences and the trauma. Maybe we can, through preventative efforts and collaborative efforts like this one, maybe we can prevent trauma or adversity from happening completely, but other times we cannot, like we have no control over completely over the environment, right? So good news is that we always have control over what we do to introduce access to the positive childhood experiences. And that's why I loved, the talk about burnout, is because really focused on that, what we can all do, right? Like those small things that we can do, again, as community members, not just as professionals, but also as just individuals. And you can advance to the next slide. So we want to really talk today about how do we foster perinatal resilience through the use of the HOPE framework. And as you see, as you hear today, and you see like the HOPE framework, it's really nothing new. It's like really strengths-based approach. It is based on years and years of research and about how do we strengthen resilience, but not just individual resilience. We also talk about community level resilience and how do I identify factors that have an impact on the perinatal period. So just how I just talked about the sensitive time where impact from adversity and trauma really can rear its head and have an impact, on the individual outcomes or the family's experiences. Is the same thing with resilience. During those sensitive times is when we really have the biggest impact. So we can strengthen that personal individual resilience through providing access to various, resources, but also we can introduce new ways, to cope with chronic stress, with additional stressors that are related to the perinatal period. And you can advance to the next one.
Thank you, Rumyana and Claire. I'm Jen Hansen with the Spokane Regional Health District, and I think I have the fun slides. The start of this is always a little anxiety producing, I feel like. But I get to talk about community resilience. And so this is really the exact opposite of the ACEs tree. And you can see the roots of this tree are equitable and trauma-informed systems and supports. That is what we're all striving for. And the health promoting infrastructure coming from having people on this call from LHJs, I mean, really looking at the built environment and how the built environment contributes to health. Affordable housing is a hot topic. We do a lot of work around integrated social services. How do we make it easier for the parents in the perinatal period to access the supports that they need within the community, where it doesn't entail calling a bunch of numbers and running around town. And so the roots of this tree really are informed by local, state, and federal policies. And so the actionable item here really is register to vote and encourage other people to do the same. There is some work with agency policies that we can impact, but the big roots really do come from policy changes. And the changes we will see in the community would be safe, stable neighborhoods, community advocacy and agency, environments that promote social connectedness. And you might think, gosh, what can we do individually about these things? And and I was going for a walk over the weekend, and my neighbors put a picnic table in their front yard. And I was like, oh, that's so cute. And they're like, yeah, this way we get to meet all the neighbors walking by and meet all the dogs. And we've met so many neighbors this way. And I thought, wow, that's such a great, easy thing to do. To just increase your odds of connecting with neighbors. Oh my gosh, can you, that beeping. Next slide. So how do you do it? Well, we promote the HOPE framework. And as Rumyana said, the HOPE framework is it's very broad. And that is what makes it so accessible on so many different levels. There are 4 building blocks, and we'll get into these in more detail in a little bit, but relationships, so safe, stable, nurturing relationships are key. Especially, we know so much about early relational health and increasing access to the supports so that we can have healthy early relational interactions are critical. The 2 biggest disruptors of early relational health are extreme poverty and untreated mental illness in the mom. And so that is a huge area of focus so that we can stabilize families and have supports in the communities where they can get their needs met. Environment is safe, equitable environments. And that is every environment from, home, doctor's office, work, parks. It's very, very broad. Engagement, feeling like you're part of something bigger than yourselves is critical for a sense of belonging. It can change the mindset that Lyndsey was talking about, to really have to look at things a different way, that you're out of your brain and you're engaging with others and you're really feeling a sense of belonging. And then, of course, opportunities for emotional growth. Those happen every day, all the time, but really taking those opportunities to grow. The HOPE framework is really powerful because it shifts the focus towards building a system of support. This is not, it can be used on the individual level. We utilize this at the community level to really talk about what is occurring within agencies, organizations, neighborhoods, systems, to really build up the strengths within a family. And it's based on the protective factors and brain science that public health has been talking about for decades. And so it's nothing new. It's a new way of, it's a narrative shift. And so the next slide. And so the HOPE framework is based on the core assumption of the science of the positive. And for those of you that don't know, the science of the positive comes out of research from the Montana Institute, and they have a conference next month. If anyone is, I think they have a few spots left. But the science of the positive is not the science of positive thinking. So I just want to make that differentiation. But the science of the positive is that the positive exists, it's real, and it's worth growing. And it always reminds me of one of my favorite quotes, that is, the grass is greenest where you water it. And a lot of times I feel like we water what we don't want to see. All of our energy is focused on the adverse childhood experiences without putting as much focus on, okay, but how do we build positive childhood experiences? And a lot of times relationships are seen as extra, they're seen as nice. They are not seen as foundational, and they absolutely are. Positive experience promote children's health and well-being. They allow children to form strong relationships and connections, cultivate a solid image of self-worth, sense of belonging, and they build skills that promote resilience. And resilience is, you can build resilience. So next slide. So as I said earlier, hope shifts the narrative. People are defined by their strengths as well as their challenges, and hope creates a presumption of strength. This is not saying that there shouldn't be assessment of risk. Absolutely. That is part of all of our jobs, is assessing the risk. But it's assessing the risk in balance with what the strengths are that someone has. And calling out the strengths, leading with the strengths. And my mom used to always say, people don't need to tell me what I'm not doing right. I know it already. And as I've gotten older, I just think, gosh, don't we all know what we should be doing better at? But focusing on the strengths and what someone is doing right can help them build upon it. It can help you form a relationship with that person by building upon it. Unfortunately, many of our systems focus on the negative. Our screening tools are often so not strengths-based. They're very much, what's the problem? How long has it been going on? It's information gathering, but not always in a strengths-based way. And that can create a presumption of deficit as well as codify implicit bias. And so next slide. So positive childhood experiences can positively affect adult health. And you can see from the graphic here, if you are experiencing positive childhood experiences and practicing the skills that lead to resilience, you will have better health outcomes. I think the biggest, most exciting thing about the hope framework and the science and research that is coming out now is showing how positive experiences buffer against the harm of adverse childhood experiences. For years, we have been talking about adverse childhood experiences with really nowhere to go, nowhere else to lead to. It was just this chunk of really bad news that a lot of people got, and there was nowhere to go. But with positive childhood experiences, you can look back retroactively and see where those building blocks were or weren't present for you. And that is really powerful. And it can break generational cycles of trauma. And so the next slide, please. So the research began over 10 years ago and is continuing and is being heavily invested in currently. And the outcomes it's showing I think, keep getting better and better. And so developing the positive childhood experience score, a lot of times people say, well, what experiences are you talking about? And this hopefully will help. So this all started in Wisconsin as part of the BRFIS survey. And the BRFIS survey, they asked about adverse childhood experience, and then they asked about positive childhood experiences. And the first science that came out, the first research that came out is that the more positive childhood experiences you have, the better your adult mental health is. And that was even more pronounced when there was a lot of adversity. So if a child experienced a lot of adversity and then also experienced a lot of the positive childhood experiences, and I will go into the questions on the next slide, they had a lot better health outcomes. And so next slide. So these are the questions that were created based on really these were the questions that were created, and then they were condensed into the 4 building blocks. But so this is retrospective. So positive childhood experiences scale question. They were asked, as a child, how often did you feel able to talk to your family about feelings? Feel your family stood by you during difficult times? Enjoy participating in community traditions? Feel a sense of belonging in high school? Feel supported by friends? Have at least 2 non-parent adults who took genuine interest in you? Feel safe and protected by an adult in your home? So, oh, I thought there was a question, sorry. So if you answer yes, if you can say yes to these questions, you would get a point. So the max positive childhood experience score would be 7. And so next slide. And so really, all of those questions are condensed into these building blocks. So relationships, there's a strong focus on relationship with adults that are not parents, to adults outside of, that take genuine interest in you. And that could be a coach, it could be a teacher, it could be a neighbor, it could be an auntie, it could be a grandma, grandpa, uncle. It's really, really powerful for children to have someone other than their parents that are adults that they can rely on. That's something we can foster for sure. Environment, so thinking of the environment questions, what's going on within the community? What community traditions are happening? We always pose this to our audience about, what are some community traditions you've enjoyed? And we have Pig Out in the Park and Bloomsday and Hoop Fest. But I remember one middle schooler had said, I love it when the when the pool's open in the summer. That, that's a community tradition. His friends would all pack a lunch and go to the pool and just spend all day at the pool. And I thought, yeah, that's such a great example. Engagement, so social and civic engagement, really this is to develop a sense of belonging, a sense of mattering, and a sense of connectedness with other people and a cause bigger than yourself. And emotional growth through playing and interacting with peers. Resilience is not something that that the skills are not developed solely. They need to be developed in relationship with others. And so the more peer interaction that children have, really the better. The more interaction people have engaging within the community to have the sense of engagement, the better. The more environments that are safe and stable and equitable, where people feel comfortable being out in the community. And then of course, it all comes down to relationships and why we need to really focus on creating opportunities for people to build relationships. And I think especially in the perinatal period is a really special time where you can develop a whole network of support. And over to you, Rumyana.
Next slide. So I know listening to Jen talk about the framework and, the questions they were asking, you might be wondering, well, why would a childhood experience be relevant to the perinatal period when we're working with adults? But we know from science that, our brains keep changing and adapt, right? And that as Jen said, resilience skills continue to be built, like it's not just one and done. So, introducing access to those building blocks is extremely important also during other sensitive periods, such as the perinatal period, when, like the person's life change or their social role change and they become parents and caregivers. So thinking about the whole framework now, and with this knowledge you have about the different building blocks, think of those building blocks really as like buckets, that we all can fill with what is relevant to us, or it's relevant to our community, to our situation, to the population we work with. So that's why I know usually in science, scientists try to be very specific and prescriptive, but really the HOPE framework was developed with that vagueness in mind, so people can actually make it their own, and it can fit in various settings. So all those positive experiences that Jen mentioned that go into these buckets or building blocks are extremely important also for the perinatal population to have also positive childhood experience, positive perinatal experiences. So pregnancy, childbirth, and postpartum. So what we wanted to do is, instead of just going block by block and giving you more examples of what can go into it, we wanted to actually make a crosswalk between the MMRP recommendations and the implementation plan, and crosswalk it with those building blocks. So you can see how each building block from the HOPE framework can actually provide you a pathway, to work on those recommendations. And you can go to the next slide. We don't have time to go through like in details about all the recommendations, but I just wanted to summarize them here. So very broadly, the MMRP group did those 6 recommendations, and I'll go through them here. But then in the next slides, we'll look into each specific recommendation and how we can use some of the building blocks to address them. So the first one and the big one is like undo racism and bias and addressing anti-racist practices and work against stigma in perinatal care. And that's really, we start with this one because it permeates through all the recommendations that were made, from the panel. The second one is address mental health and substance use disorder. And how do we do that is by increasing access to appropriate, culturally sensitive and safe mental health and substance use treatment, but also prevention practices. And this is really where HOPE comes into play as well, because as you can probably hear, its focus is really on primary and secondary prevention, and really looking into how do we create environments where focuses on health and wellness. The third recommendation, and I apologize, my puppy just woke up, so you might hear some barking. The third recommendation is enhance healthcare quality and access, and that is really about expanding equitable and quality healthcare, not just through providing more, but actually through integrating and collaborating between existing also providers and services, and enhancing other ways of providing care and support through the use of telehealth, for example. The fourth recommendations is around strengthening clinical care, and this is where we talk about all kinds of care, not just medical or healthcare based. We also look into emergency care and culturally appropriate and responsive care, such as doula and doula work, and like community-based doulas, home visiting, and so forth. The fifth is really looking at those basic human needs and how do we meet them, but again, as a community. So looking more as a system level in a community-based approach to providing supports to the perinatal person and their family. And then the last one is around addressing and preventing interpersonal violence and also community level violence. And you can move to the next slide.
So for addressing strategy 1, which is undoing racism and bias by addressing racism, discrimination, bias, and stigma in perinatal care, one of the tools that the HOPE framework really focuses on is shifting from type 1 thinking to type 2 thinking. And usually when we have a little bit more time, we'll show a graphic. It's an illustration. And at first glance, it appears to be a caregiver with maybe 3 or 4 kiddos spread around a living room, and often, and so we usually ask folks, when you look at this picture, what do you see? And oftentimes the things that people are very quick to point out is the caregiver looks like they're smoking. There's pizza and soda on the table. That's not very healthy food. There's cracks in the walls, things like that, all of which is in the illustration. And then we ask them to pause and to think a little deeper and say, so those, you know, as Jen said, it's important for us to see the risk factors. What protective factors do you see in this picture? And oftentimes folks have a harder time initially seeing the protective factors, but when they look, they're able to identify, you know, there's a caregiver in the room, they might be smoking, but, you know, they're smoking in a corner slightly away from the kids. There's a baby sleeping on their back. You know, the fact that the food is pizza doesn't negate the fact that there's food. There's a crucifix on the wall. So maybe faith is an important part of this family's community. The kids are reading. So we always use that illustration to point out that it is really easy to lean into what we call type 1 thinking, which is fast, it's unconscious, it's what we as providers have been trained to do to keep people around us safe and to keep our patients and clients safe. It is what we have been taught to do through everyday activities, through our training, through our work, and through our experiences. But type 1 thinking, because it is often so unconscious, often is laced with implicit bias. And for those of us that do the work that we do, oftentimes we are so trained to quickly assess a situation and to identify what risk factors are there, which is our jobs to keep people healthy and to keep people safe. Oftentimes we're using that type 1 thinking, and that doesn't always leave room for type 2 thinking. Type 2 thinking is slower, it is more conscious, it takes a little bit more work, and it is something that you have to pause. I at least have to pause and ground myself in, whereas it's very quickly for me to walk into a room and to jump into my type 1 thinking. Type 2 thinking, I often have to stop and remind myself, let's identify the type 2 opportunities here. What is going well? What are protective factors in this situation in addition to risk factors? It perceives variability, it takes different perspectives, and it is often a way for us to address our implicit bias. So this is a tool that we really recommend people using to lean into suggestion 1 from that mortality review. And as you can see in the bottom right-hand corner, this ties into the relationship building blocks. When we meet someone new, when we're interacting with a client or with a patient, are we pausing, thinking very intentionally? Are we looking for protective factors in the stories or circumstances that they're telling us, as opposed to just using type 1 thinking? Next slide, please. So for suggestion 2, addressing mental health and substance use disorder, increasing access to mental health and substance use disorder prevention, screening, and treatment for pregnant and parenting people. This this use of the HOPE framework, you can see, is tied into the emotional growth building block. Positive childhood experiences are really fascinating because you can see here that folks that have higher positive childhood experiences have higher mental health outcomes. And we're going to talk about this in just another slide. But in fact, people that have high amounts of adverse childhood experiences, who have experienced 4 or more, if they're still experiencing 5, 6, 7 positive childhood experiences too, they have much better health outcomes, and particularly for mental health. So you can see here that when we are providing opportunities for positive childhood experiences to kiddos, we are proportionately impacting their mental health as adults. And you can see here, there's a pretty astounding difference between the 51% of folks who have good mental health, identifying that they've only had up to 2 positive childhood experiences, versus the 87% of folks who had 6 or 7 positive childhood experiences as kids and who are now feeling much more equipped and much more mentally supported. Next slide, please. This is my personal favorite slide of the entire presentation. You can see here that across this graph, this is for people that have 4+ ACEs, which that's That is a number of adverse childhood experiences. So these are people that have experienced some trauma. And you can see here, we are looking at the percentage of folks who have depression or who self-identified as having poor mental health. And so you can see on the left, folks that have 4 or more adverse childhood experiences and only had 1 or 2 or 0 positive childhood experiences, those people tend to have a greater likelihood of suffering from depression or struggling with their mental health as adults. For folks that had a decent amount of positive childhood experiences, they had some ACEs, they suffered some adversity, they had some trauma that they had to endure, but they also had some experiences that were positive. They had relationships that were strong. They had environments that felt safe. You can see that their likelihood of later experiencing depression or poor mental health as an adult, it drops pretty considerably. It goes from 60% to a little under 40%. And then we can see that the folks that had a lot of positive childhood experiences, 6 or more. So again, folks, they had adversity, they had trauma, but they also had a really solid foundation in positive childhood experiences. They are significantly lower. They are almost half as low as folks that had 1 or 2 positive childhood experiences. And I find tremendous hope in this because as a social worker, I often am working with kids or young adults who have already experienced a lot of trauma. And sometimes I can get caught in the loop of, you've already had this experience. I can't fix the fact that you've had this experience. How do I support you? How do I negate this adversity that you have already had to go through? And this framework reminds me, I don't have to go back in time and fix something. I don't have to negate the adversity that someone has experienced. I can really make a difference and I can really set this person up for success, and I can concretely support them, not just by removing the adversity in their lives, but in adding the positive childhood experiences. So adding enriching environmental opportunities, adding good relationships, adding opportunities for them to be involved, adding opportunities for them to experience healthy emotional growth. That is a very important intervention and a very effective intervention. Next slide, please.
Is this me?
I think it's me, Jen. I think
or
it's
Jen. Okay.
Sorry, my computer froze right as you were talking, Claire, and I was like, thank you. So enhance healthcare quality and access. So expanding equitable, high quality healthcare by improving care integration, expanding telehealth services, and increasing reimbursement. You might remember in the resilience tree that improving care integration was in the roots of that tree. And the way that you can do this is through advocacy, professional organization, engagement, coordination, and collaboration. And this falls under the engagement building block of being part of something bigger than yourself, encouraging others to be part of something bigger than themselves, to recognize collective power, and also just sense of belonging and connectedness. And then next slide.
And that's me. But I just wanted to mention also of being something bigger, like it's exactly this example of like what you're doing right now, right here with the collaborative. Like you are actually providing access to the building block of engagement to yourself. And this is something we didn't mention earlier. I know we're thinking of families we serve and individuals we serve, but very similarly to the burnout prevention talk, we have to give it to ourselves first. You know, so when we talking about access to the building blocks of hope and using the framework, always think about how does it impact you as well as a person, as a professional. So this fourth recommendation about strengthening clinical care talks specifically about the use of culturally safe and responsive care practices, that are, again, coordinated and comprehensive. Very often providers, we hear from them is like, yeah, people want to fund new and innovative ways, but what about existing ways of doing work, right? And like, how can we continue doing good work that it has proven its worth for the community, and integrate it with also with the new and innovative practices, right? So we talked about also adequately staffed hospitals and clinics and care settings, and really asking the question of, do we know, what community needs from us? Do we know what the strength of community is, and how do we then become responsive, to those needs? And you can move to the next slide. The fifth recommendation, as we said, it's really going about meeting basic human needs. And this is really where case management shines, and a lot of the care coordinators and navigators, their work is so important for improving perinatal outcomes and just the overall experience during the perinatal period. So we talk about how do we connect, how do we identify good referrals in the community? And I think that's why collaborative like this one are so important as well, not just for the education, but also for the networking opportunities and for learning about what's happening in the community, what works, and then how do we support it together collectively. This specific recommendation connects directly to the building block of the environment. If you remember, Jen mentioned that environment is quite broad. It can speak about the community environment where we live, but really also can talk about that small specific interaction you have with a person when they come, let's say, for a visit during pregnancy, or even just, during the childbirth, like thinking about what is the environment that I'm providing for that person and family? Are they, again, responsive to their needs? Are they relevant to their culture, to their background? Are we also providing them with opportunities to speak up and voice concerns if things are not sitting right with them? And then are we listening and be responsive to them? Not just encourage advocacy, but also, of course, we have to support that and be responsive to it. The big thing piece to this, it can be very overwhelming sometimes because a lot of aspects of safe environments are out of really our control. So bringing that mindset and perspective to asking ourselves, what is in my control? So maybe I don't have control over, let's say, big hospital policies, right? But I do have control over the specific interaction I have with this family. So how do I set it up to be safe? And how do I make sure, again, then later I advocate for changes that in policies that may be affecting the experience of the family. And you can move to the next slide. And the last one, the last recommendation, if you remember, it's the addressing and preventing violence. So not only interpersonal, we know from science, from research, that the perinatal period is a sensitive period for experiencing increased rates of violence, especially if it's already existing within the family unit. So it's really important to know what's out there in the community, understand what the resources are, and timely connect and refer folks to those resources, and utilize that warm handoff and utilize that approach to making sure we're connecting them directly to preventative services, engage with also as providers ourselves, engage with continuous learning and training and education, and also make sure we continue to learn and grow ourselves as professionals and individuals. And you can move to the next slide. And this really leads us to like a short discussion. I know we don't have a lot of time, but what we want to invite you is to really think about maybe your own personal work that you're doing within the perinatal period, and think about, what's where do you see those building blocks?
This is Annie at Benton Franklin Health District, and this really isn't anything different. It's just reframing and thinking about what you're doing in a more positive, hopeful manner. And there's no such thing as low hopes, by the way. But it's that client-centered care and seeing the client first, even though it might be your 5th client of the day, but it's her first visit in. And remembering that when you're seeing that client, and really listening and finding those positive things that she's doing before you start focusing on the things that y'all need to work on. Does anybody else have some thoughts that they would like to share? How this might be fitting into the work that you're already doing?
Hi, this is Jax with Tacoma Pierce and the chair of the Perinatal Collaborative. Thank you all so much for this. It's really, really so phenomenal. At the health department, we're restructuring right now under new leadership, and it feels like a really exciting opportunity to think about how this framework can shape and drive a lot of our work. Across multiple of our divisions, but it seems like this would be an exceptional framework to think about our larger goals and our strategic planning.
You know, just small things that some of you may have noticed. You know, some of the ads for the Buckle Up campaign over the last 5 years, 5 to 10 years ago, it was, you got to buckle up, you got to buckle up. And if you notice the newer campaign, it's 80% of you are buckling up. Isn't that great? You know, just reframing that thing in a positive manner. That's part of the things out of Montana Institute with positive experiences, just reframing into a positive light. Because it's not that everybody's smoking. It's that there's a few of them smoking, but everybody else really isn't. So how to have everybody jump on what everybody else is doing. So.
We are taking also, I like what Jax said about like strategic planning. So we are also in the process of strategic planning. So hoping we influence that as well, but we're taking it on a smaller scale with our community health division. And we're using the HOPE framework around, you know, work planning and looking at different projects that we can maybe work together from various programs. So yeah, it can be really, I think the beauty of it is because it is so broad that it can be adapted to many different projects or programs or even like agency work. Yeah.
I've also really appreciated using HOPE even within the team that I'm working on. So the website that we'll share after this has a ton of 1-pagers and 2-pagers and handouts, and one that I always find really useful. There's a HOPE informed supervision, and it's so nice. And I have used it when I'm being supervised, working with my own supervisor. I have started implementing it in other roles where I am working with folks and delegating and directing. And it's very concrete, simple reminders of, it's so easy, especially when I'm reviewing my own work, to focus on what I'm not doing well. And it's so nice to have a reshift and a reframe of focusing on what I'm doing well and focusing on the community building that I'm doing, and just focusing on what the environment that I'm working within. It's like, I have found that to be such a helpful tool and such a good way to just start sprinkling and planting the seeds.
Claire, I'm really excited that you do have some tools to share that we can incorporate, like you said, within our teams or within ourselves and how we address our own work day to day. It can be sometimes overwhelming when you think of things from this really broad standpoints, like where do I begin within this, and wanting to make an impact and realizing that I can start adopting these myself in how I do my own work each day, or I'm thinking about my own work. I can adopt these in how I'm interacting with my colleagues throughout the day. And that can help make this practice of thinking in a new way easier to do, because we want to just fall back on that like reflexive thinking and let our biases, you know, play in. But if we get more opportunities for practicing thinking in this way in an environment that doesn't feel so broad and overwhelming, I just think that that can then feed out into the greater bodies of work that we're doing. So I look forward to that.
Thank you for saying that. One thing I just wanted to add is that, and when Rumyana and I do this like presentation with a lot more time, we talk about how we came to this model, and it was so big and it felt so squishy to me that I thought, how on earth are we going to sell this? Like, how are we going to have people incorporate this? What does that really look like? And honestly, it wasn't until I internalized it, and I think that is where the key is with this work, is to look in your own past and see where you had access to those building blocks and the impact that had on you specifically in your trajectory. Because I feel like that was when I really recognized the power of small things that people did that added up. And so I would just put that out there, because I remember really feeling like, where do you even start with this, and how, because everything does seem so big, but hope brings it down to be actionable. Like, you can be present with a client and form a relationship. You can ensure that the exam room or that your office feels like a safe place for people. And so I just wanted to put that out there, because I know how overwhelming this is at first. But once you realize how actionable and how important small things are and the cumulative effect they have, the more of a believer. Hi.
That's huge, Jen. And, you know, a lot of that holds true for me as well. And just thinking about those small things that do add up. And when many of us were taught the ACEs, and everybody had to take their little test, and it's like, okay, here's all these things, and you know, there's no hope at the end of getting done with your ACEs score. And then this comes along, and it's like, there is hope for all of those ACEs scores and those clients that we see that have high ACEs scores, and what can be done to have that resilience and to overcome those things and be able to have a wonderful life and have that for their families as well.
Ruba, were you trying to unmute? Did you have something you'd like to share?
I don't really have anything to share. No, I'm so sorry. I'm listening and I'm watching, but I'm also like responding to emails. I can share if you would like. Yeah, I would like to talk about the listening sessions we have done. Let me introduce myself. Let me slow down. My name is Ruba Ayub. I'm the advocacy manager for Pierce County Early Childhood Network, initiative funded by First Five Fundamentals. So how do I promote equitable access to one or more building blocks in my work? Is through community outreach, community engagement, through listening sessions, through advocacy, through advocating for policies that really help our communities and address the issues that you all went over today. So I want to share a little bit about the listening sessions that we have done in the past. And that was not only to like build relationships with community members here in Tacoma and Pierce County, but it was also to create a safe space for everyone to come in and share their experiences, to give us feedback and to tell us about their experiences and what they're going through and how would they like us as PCCN to help them and support them. And it wasn't just a space to like, you know, engage with community, work with them, ask them questions about the issues that are impacting them, but it was also a space to create solutions, to like figure out, okay, well, the issues of, childcare cost is impacting our community. So that's an issue that we need to like talk about. And then we talked about it, and then everyone was sharing like how they want more accessible, affordable childcare and how that's like really important for them, and that they want more connections and support connections to support services and resources that exist. So we talked about 211, right? So it was like a way to like not only share resources that already exist, but also like talk about solutions to the issues that our families and parents, childcare providers face every day. And then once we did that, I worked on the legislative priorities for 2024 for PCCN. And then one of the top priority was accessible and affordable childcare. And then we went in and talked to senators, House of Representatives of Pierce County, as well as King County, about like accessible childcare, what that looks like, which of course means, cheaper, affordable childcare, but also like supporting our childcare providers. So we were advocating for our childcare providers, but also like advocating for our parents and our families and our single mothers and our single parents. So we were able to do that. So I believe all these boxes connect to the work that we have done in terms of like equity. But yeah, I hope that makes sense. Thank you.
That was great, Ruba. That made perfect sense. You did hit. And one thing we didn't say, the boxes are so intertwined. It's really hard to talk about relationships without bringing in environment, without, I mean, they're really intertwined. It's all, yeah, all interconnected.
And just a time check, we have about 1 more minute left for discussions. If anyone else has anything they'd like to contribute before we'll work toward our closing.
We can go through our last slide just so folks know where to get some additional information and resources. And then one more. Oh, just kidding, I lied. So if you go to the HOPE's website, which I can drop in the chat or our team can drop in the chat, or if you go to the link that I've already dropped, the research archives, that is where you'll find a lot of the 1-pagers, the 2-pagers. I also really appreciate there's a lot of resources in Spanish and in additional languages. So there are handouts that you can provide to practitioners, to families you work with, to patients in a variety of languages. That is a great place to look. There's also a bunch of trainings on how to participate in HOPE. And if you're interested in joining our community of practice, if you want to send me an email, you can see my email is listed here, claire.kenneally@doh.wa.gov. We would love to chat a little bit more and invite you. If you are interested in getting trained up like the 4 of us are on this framework so that you can then go out and share the word and be a presenter, that's also an option. And I will volunteer Rumyana, Annie, and Jen if anyone has questions or any sort of follow-up. We're all really happy to connect and really grateful to have been here with all of you.
Thank you so much to all of you for taking the time to share this fantastic information. I'm really excited to learn more about incorporating this into my work and understanding how the work that we're doing at the department is already intertwined with all of these concepts. And just thank you for sharing with us. And if you have any of those documents or action like tools that you wanted me to attach with our slides on our website, I'd be happy to do that. So you're more than welcome to send those my way as well, Claire. Again, thank you all. Thank you to all of our PCPC members that took time out of their Mondays to spend with all of us. I appreciate all of you being here. Please do take a moment before you jump off to scan this QR code that's on the screen here and take our post-meeting survey. We always appreciate your feedback on how these meetings are working for you. We will also be sending out an email this afternoon that will have a link to this survey as well. Just a reminder that our next meeting coming up will be on September 9th, and we'll have some other amazing speakers lined up for you then. But thank you all. That's time for us today, and appreciate all of you.